Good morning.
Oh, good morning.
Hi, your first patient is here.
Great. What's today looking like?
Pretty full. Back-to-back appointments until 1.
Okay. Who's on deck?
Laura Santos. I'll get Laura.
All right. Oh, yeah, Laura, right. We had a great little conversation last time she was here. She had some really good questions.
Laura? The doctor's ready to see you.
Oh, great. Thank you.
See you.
You too.
Great.
Thank you.
Good morning, Laura.
Hi there.
How are we doing?
Honestly, I'm a little anxious to see my results. So, you tell me. I mean, last time I was here, I saw everyone in the office. You, the hygienist. Gum disease? Really? But I brush and floss all the time. Are you sure you have the right chart?
Yes, it's yours. In fact, when I was looking at your teeth, I noticed a little more buildup than the last time.
Thanks, Valerie. See, that's the thing about gum disease. You can get it even if you brush and floss regularly. And it can progress without seeing or feeling any of the obvious signs like swelling or bleeding.
Gum disease. Is it serious?
Well, it can be. Let me explain to you what's happening. In every mouth, there is both good and bad bacteria. And when there's too much of the bad, it can lead to an infection, gum disease, which is what's happening in your mouth.
Bad bacteria in my mouth. So how do I get rid of it?
Well, you have a couple options. Let me walk you through them, okay? Right now, you have some pockets that are measuring 5 millimeters.
Pockets?
Well, let me back up a bit. Because of the infection, the gum separates from the tooth, and that space is called a pocket. And I use this tool to measure the exact size of the pocket. Do you see these little lines? They're millimeters.
So is a 5 good or bad?
Well, it means it's time to take action, so I'm glad you're here now so that we can talk through your diagnosis. You see, a pocket measuring 4 millimeters or more is cause for concern. And we don't want to wait because gum disease won't get better on its own. If left untreated, it could lead to pain, bleeding, bone loss, and ultimately tooth loss.
I don't want to lose my teeth.
Well, no one does. But based on what I'm seeing, I'd like to start with scaling and root planing. It's also called SRP, and an antibiotic. I'll remove all the plaque, bacteria, and calculus that I can, and then I'll smooth out the root surface.
Is it effective?
Well, the combination of SRP with an antibiotic called Arrestin is very effective.
What's Arrestin?
I've been using Arrestin for years. It's a locally applied antibiotic made up of tiny microspheres, or particles of medicine. It's placed directly into the problem area to kill the infection, and it keeps working long after your treatment.
But why do I need it?
Well, because you need the combination of SRP with Arrestin to kill the bacteria left behind.
So I have some questions.
I know it's a lot to take in at once, so why don't we go talk about it?
Is Arrestin painful? And how long does it take?
Well, SRP may cause some sensitivity, but Arrestin itself is painless. I'll apply Arrestin right after SRP. This way you can get both treatments in one visit, so there's no need for an extra appointment.
Will I be able to eat?
Oh, yeah, sure. Just avoid eating hard, crunchy, or sticky foods for 1 week so that the area can heal properly.
Is it covered by insurance?
Coverage varies, but we can check if it's covered by your dental policy. We can look into it for you. Just ask at the front.
Is it safe?
Yes, it's safe.
I don't want the infection to get worse. You really think Arrestin with SRP might help?
Yes, I've seen it help lots of people in your situation. You know, treatment for gum disease isn't something you should put off because it could lead to surgery or tooth loss.
Okay. I'm ready to give it a try.
Things seem to be healing up nicely. 2 millimeter pocket depth reduction. I like that.
Is that a good amount?
Well, it's a clear sign of improvement. Now we just have to keep an eye on it.
The infection won't come back, will it?
There are no guarantees, but I can do my best to help you prevent it. Now, as your gums heal, it's important to practice good home care. Brushing twice a day, flossing, rinsing. And don't forget to schedule your next appointment before you leave.
Okay.
Let's get you out of this chair.
Thank you.
You know, Laura, I've seen a lot of great results with Arrestin, and you're one of them. Do you remember how hesitant you were when you first came in? Yeah. How do you feel now?
Actually, relieved. I'm really glad I didn't wait.
Arrestin, minocycline hydrochloride microspheres, 1 milligram, is indicated as an adjunct to scaling and root planing, SRP, procedures for reduction of pocket depth in patients with adult periodontitis. Arrestin may be used as part of a periodontal program which includes good oral hygiene and SRP. Arrestin contains minocycline, a tetracycline derivative, and therefore should not be used in children and pregnant or nursing women. The use of drugs of the tetracycline class during tooth development may cause permanent discoloration of the teeth. The most common treatment-emergent adverse events were headache, 9%, infection, 7.6%, flu syndrome, 5%, and pain, 4.3%. These occurred at a similar rate to SRP and SRP plus placebo.